We are just some of the breast care nurses who are here to help coordinate your care and support you through the pathway.
Hello, my name's Rachel and I'm the Breast Oncology Clinical Nurse Specialist. The purpose of this video today is to inform you and advise you of your forthcoming oncology treatments. These will consist of chemotherapy, radiotherapy, hormone therapy and bone strengthening therapy. All the treatments that have been planned for you have been decided between the multidisciplinary team. These consist of oncologists, surgeons, radiologists, histopathologists and nurses. There are two main pathways that your treatment may take. Your pathway will have begun upon the Primrose unit, whether this was a screening recall or whether you found a lump. Following your visit to the Primrose unit, you will have been discussed in the multidisciplinary team meeting. The most common pathway will consist of surgery first, followed by what we call adjuvant treatments, which may consist of chemotherapy and radiotherapy. The other pathway, known as neoadjuvant treatment, will consist of chemotherapy first, followed by surgery and followed by maybe radiotherapy. Again, this will have all been discussed with you in your consultation with your oncologist. Your oncology team will consist of either Dr. Dubey, Dr. Garanova or Dr. Panois. It will also consist of various registrars who you may see throughout your treatment. These work on a rotational basis. There are two specialist doctors, Dr. Prance and Dr. Dickens, and myself, Rachel, and my colleague Kate Lansdowne. If you are having adjuvant treatments, chemotherapy will always precede radiotherapy. Next, we will run through some common side effects of chemotherapy, followed by some useful hints and tips to get you through the treatment. Common side effects of chemotherapy. Hair loss. Whether you're using the cold cap or not, some degree of hair loss is likely. You may minimise this by using baby shampoo or simple shampoo, washing your hair infrequently and minimising your use of heated appliances. Your scalp may become sensitive and you can make this more comfortable by wearing a silk scarf or using a silk pillowcase at night. Headaches. Headaches are very common. You may use analgesia such as paracetamol and ibuprofen, as long as you check that you do not have a temperature beforehand. Dry eyes. Dry eyes often happen when you lose your eyelashes. You can help with the treatment of this by using simple over-the-counter eye drops. Dripping nose. Again, this is very common and often ladies think that they may have developed a cold, when in actual fact the reason for this is because you may have lost the hair up your nose. Stock up on tissues and use Vaseline to minimise soreness around your nose. Sore mouth. You will receive mouthwash, which you should use frequently. Use a child's or baby's toothbrush and sensitive toothpaste to minimise gum bleeding. Use a lip balm for dry lips. Ice lollies or frozen pineapple can also help with your dry mouth. Acid reflux or heartburn. You can use Gaviscon or any other antacid. If these are still not helping ease your pain, speak to your treatment team. Upset tummies. This is very common and you will be given anti-sickness tablets to take post-chemotherapy. It's important that you take these as prescribed to minimise any nausea or vomiting. You may require treatment for your bowels. You may be suffering from diarrhoea or constipation. Talk to your treatment team as we will be able to prescribe supportive medication for this. Ginger can be helpful to ease nausea, as can ginger biscuits or ginger cordial. Some people have often found travel bans help. Changes in your appetite and weight. Eat little and often, but try to maintain a healthy diet. It's easy to be drawn to sweet foods. Be aware, most ladies gain weight whilst on chemotherapy, which can become hard to lose afterwards. We prescribe your chemotherapy based on your body surface area, which is an equation between your height and weight. This is why we will always weigh you before chemotherapy. Dry skin. This is very common. Moisturise regularly and refrain from being in the sun. General aches and pains. Take analgesia, paracetamol or ibuprofen is fine. Always check your temperature before taking and speak to your treatment team if you require something stronger. Nail changes. Nails may become weak or brittle. Use hand creams and nail strengthening varnishes. Peripheral neuropathy, often referred as pins and needles. You must let your treatment team know if you are experiencing this, as it can be irreversible if ignored. If you would like a more detailed explanation about what happens when you have chemotherapy, please visit the link below. If your treatment team has decided that you require radiotherapy, this will usually happen approximately 4 weeks following surgery or 4 weeks following your completion of chemotherapy. Radiotherapy is deep X-ray treatment. There are 2 main time frames that you will be given this treatment over. One is Monday to Friday for 1 week, the other Monday to Friday for 3 weeks. You may also be given a boost and be asked to perform a deep inspiration breath hold technique. All of this will be explained by your treatment team. As part of your radiotherapy treatment, you will be asked to attend for a CT scan. It's really important that you are still continuing with your exercises, as you will be asked to hold the position with your arms above your head for some time. Common side effects of radiotherapy. Skin changes. The area being treated will turn pink or red and may in extreme cases break down. You can combat this by moisturising frequently. Use the cream given to you by the radiotherapy department and apply as often as possible, but not prior to your treatment. Long-term skin changes may result in a darker area, similar to a tan. The breast may become smaller and firmer as the months and years go by. You may get small red spider veins appear, known as telangiectasia. This will happen months to years down the line. Having radiotherapy increases your chances of lymphedema, whether this be in the breast or the arm. If this happens, please contact your breast care nursing team. Tiredness is one of the most common side effects of treatment. This usually occurs a couple of weeks into your treatment and continues for a number of weeks after. Some top tips to get you through radiotherapy. If you want to use deodorant, please use a roll-on and make sure you do not apply it prior to your treatment. Wear a thin vest prior to your treatment that you can pull down to the waist. It's easier than finding a gown. Savoy cabbage leaves or breastfeeding nursing pads kept in the freezer may help with cooling down the area after you've received treatment. Ensure you stay out of direct sun whilst having treatment, and for a year following taking extra precautions. Apply factor 30+ sunscreen, even under clothing unless UV treated. Expect side effects to happen 2 to 3 weeks into your treatment or even after. You may experience some rib tenderness following your treatment. Again, this is very common and you may treat this with simple analgesia. Rest when and if you can, because tiredness can catch up with you. For more information, please visit our specialist radiotherapy video.
Hello, my name's Kate and I'm a nurse consultant working in the breast cancer team. You may have been told as part of your treatment plan that you have hormone sensitive breast cancer, which means that you need to take a hormone tablet or an anti-hormone tablet to reduce the estrogen in your system to help manage your breast cancer long term. There are 2 different types of hormone therapy. There's one called tamoxifen, which we tend to prescribe for women who are perimenopausal, premenopause, or for men with breast cancer. Tamoxifen works by blocking the estrogen receptor on the breast cancer cell and not allowing the estrogen to attach to it, and then helping to generate growth. The other type of hormone therapy is the aromatase inhibitors, such as letrozole, anastrozole and exemestane. These are prescribed for postmenopausal women. After the menopause, when our ovaries have stopped working, which is where most of our estrogen is produced, we then do generate some estrogen from our body cells, such as fat cells. This is also generated with a protein called aromatase. These tablets, as aromatase inhibitors, can stop this protein working and then reducing the availability of estrogen. There are a number of side effects with the hormone therapy. The main one that women comment on is the menopausal symptoms that it can generate. For some people, this is hot flushes, which we suggest you use loose cotton clothing, layer your clothing so that you can take items off and then put them back on. Reducing things like caffeine, alcohol can also help with this. There are some supportive medications that can be considered if your hot flushes become difficult to manage with your quality of life. Some people do find they can be worse at night, and in this situation we suggest that people consider using fans, having windows open, and again using cotton bed sheeting and clothing. There are other complementary therapies that some people do consider. We do not encourage people to take natural or estrogen products as we are obviously trying to avoid too much estrogen. If you are considering complementary therapies, please discuss this with your breast care nursing team or medical team. People on hormone therapy can also comment on joint aches and pains. This is a reasonably common side effect with these medication. We do encourage people to consider things like joint care remedies, chondroitin and glucosamine, and some women have commented on turmeric being of benefit. Trying to exercise regularly and to keep your weight well managed is important with reducing the pressure on your joints. You can also take analgesia, such as paracetamol and brufen if you are able to, and use some of the rub-in gels. Another side effect which is not often discussed, but I am aware many women do have difficulties with, particularly with the aromatase inhibitors, can be vaginal dryness. This can be quite a distressing side effect, as it can cause discomfort and may impact on physical relationships with partners. There are many moisturisers such as Yes, Silk or Replens that your medical or GP service can prescribe for you. Very occasionally we do consider using an estrogen-based topical cream to help with the discomfort or problems with sexual function. There are psychosexual support services available via our Mustard Tree services if you would like to discuss this further. Using cotton underwear and the moisturisers can really help. Please discuss this with your breast care nursing team if you want any more advice.
I'm Gemma Pooley, one of the surgical breast care nurses, and I work at the Primrose Breast Care Unit. If you have any concerns or questions regarding your surgery, then please give us a ring. We are available Monday to Friday, 8 till 5 on Plymouth 01752 431 898. If you have any surgical questions or concerns regarding recent surgery that you may have had, we run a surgical nurse-led drop-in clinic. Please ring us on the breast care numbers so we can give you a time and a date to come in and see us for a surgical review of your recent surgery.
Following your surgery, you will be asked to carry out exercises to help regain your arm movement and aid recovery. You should start these exercises the day after your surgery. You will be given basic exercises that you should carry out for the first week following your surgery. You will be then given more advanced exercises which you should carry out from the second week after your surgery and beyond. It is important that you continue your exercises following your surgery and throughout further treatments such as radiotherapy. The first of your exercises are a warm-up and a cool-down. The first one, shoulder shrugs. Keep your arms loose and relaxed by your sides. Shrug your shoulders up towards your ears and lower gently back down. Shoulder circling. Keep your arms loose and relaxed by your sides. Shrug your shoulders up towards your ears, then circle them back and down. Bent arm forwards. Bend your elbows and rest your hands lightly on your shoulders. Raise both of your arms forward so they are right angles to your body. Lower your elbows slowly. Bent arms sideways. Rest your hands on your shoulders, but this time raise your elbows out to the sides. Lower your elbows slowly. Back scratching. Hold your arms out to the sides and bend your arms from the elbow. Slowly reach up behind your back just under your shoulder blades. Slowly lower your arms back down to your sides. Winging it. Place your hands behind your head with your elbows pointing forwards. Bring your elbows back so they are pointing out towards the sides, then return to the starting position. Those were your basic exercises. Here are your more advanced exercises. Wall climbing. With your feet apart, stand close to and facing a wall. Looking straight ahead, gradually work your hands up the wall, sliding them or using your fingers to climb. Get as far as you can to feel the stretch but not pain. Hold here and count to 10. Slide your hands back to the shoulder level before repeating the exercise. The aim is to try and get higher each time. Step 2. Stand sideways with your affected side nearest the wall. Put your hand on the wall, keeping your elbow bent and your shoulders relaxed. Look straight ahead and gradually creep your hand up the wall as far as you can, allowing your elbow to straighten. Hold here and count to 10, then lower your hand back down. Arm lifts. This will be demonstrated standing up, however you should do this lying down. Lie on the bed or floor with a cushion or pillow to support your head. Take 3 or 4 really deep breaths and concentrate on relaxing your shoulders so that they are not haunched up towards your ears. Clasp your hands together or hold onto a stick. Keep your elbows straight and lift your arms up and over your head as far as you feel comfortable. Hold them here and count to 10 and then lower your arms slowly. You may find it useful to put a pillow behind you to support your arms. Elbow push. Lie on your back with your hands behind your head and your elbows out to the sides. Gently push your elbows towards the bed or the floor as far as comfortable. Hold and count to 10. Repeat each exercise 5 times before moving on to the next one, and try and do your exercises 3 times a day, morning, afternoon and evening.
I'm Mary Anderson and I'm one of the cancer support specialists at the Mustard Tree Cancer Support Centre. In normal times we would be greeting people at our centre and making them a cup of tea and hopefully sitting down and letting them talk and us find out a little bit about what the priorities are for them and anything they might be struggling with. At the moment obviously we are unable to do that, so we are very much here in the background, albeit either by virtual appointment or by telephone. And my role as a cancer support specialist is to find out, as I say, what the priorities are for the patient and anything they might be struggling with, but also then to help them explore what we have here by way of support at the centre. After an initial conversation, that would usually start with one of the cancer support specialists. We can work out with the patient where they're struggling and what we have here by way of help. Sometimes people talk to us about counselling, but when it comes down to it, they might not need formal counselling. They may just need advice, information, support, and just a listening ear and somebody to help gently point them back in the right direction. And that would be somebody like the cancer support specialist. So most of us have a background of nursing experience. I was a nurse for about 20 years, but I've done all sorts of other things, working over at the hospital for a long period after that, and came here 6 years ago. So we have very different experiences between us. If somebody does need formal counselling, we can actually discuss with the patient and make that referral. We always have to make it known that there will always be a waiting time for formal counselling, and that can run anything between 8 to 14 weeks, given how many referrals we're receiving. During that time, the support specialists are very much here to help people and support them until they are ready to meet with their counsellor, and we can do that very ably. The counselling sessions are open-ended, so when people are referred to other community counselling services, they may be told that they can only have up to 6 sessions. In fact, we know that many of our patients require more than 6 sessions, and so if that is necessary, that won't be a problem. And they will then work out when they feel able with their counsellor to actually step back from the counselling.
Part of the thing that we often see is that patients are really struggling with anxiety levels, and they can be very high, and that can actually be a barrier to treatment. So although our complementary therapists are unable to offer the touch relaxation therapies at the moment, what they can offer are some really good one-to-one virtual sessions offering relaxation and well-being. And that's using things like the breathing. The breath actually can help us to relax very, very ably, and our highly skilled therapists will talk people through those exercises and give up to an hour-long session, or sometimes repeated sessions, one-to-one over a webcam, and that works very, very well, and we've had some great feedback about that already. We also have a benefits specialist. We know that when people undergo a cancer diagnosis, that one of the first things that can be a great stress to them is financial concern. So our benefits advisor has actually had years of working with the DWP and is very, very experienced, can talk them through the paperwork and applying for benefits. She also has knowledge of a number of grants that may be appropriate to apply for, and also some other very practical advice that she can help patients with. The benefits advisor can talk to the relative of the patient with the consent of the patient. It sounds odd to talk about exercise when we think about somebody having a diagnosis of cancer, but in actual fact we know that exercise can be an excellent way of managing our mindset and helping us feel more positive, and that then releases endorphins, which helps to relax us and makes us feel happier. So there are a number of exercise opportunities, albeit that they will also be virtual at the moment, and those can actually be gone through with our Living With and Beyond team. So a point of contact initially with the mustard tree is usually with one of the cancer support specialists, and from there we can work with the patient to understand what their needs are and work with them to make sure that they get the very best support.